Representative Proctor, thank you for coming in with me today. I do appreciate it. Frankfurt's coming up. Session is coming to January, and there's going to be a lot of priorities and fights. Things are more important to people than others. You represent me in my home district, the 60th, so thank you for that. So tell me, as my state rep, what is your top legislative priority going into this session, and how does that affect the voters of the 60th district?
Well, thank you for having me, and thank you for asking. The top issue certainly is Certificate of Need. And for those who don't know what it is, it's a government permission slip that somebody must obtain before a new health facility can come into the state of Kentucky. So that could be a hospital, ambulatory surgical services, ambulances, PET scans, MRIs, home health care, outpatient PTOT speech, chemical dependency, mental health. The list goes on and on.
Sure.
In Kentucky, we are one of the most restrictive states with the Certificate of Need, having over 30 services and technologies that are regulated by Certificate of Need. Contrast to our neighbors to the north, where Indiana and Ohio only have one CON, and that's for long-term care. And our neighbors to the south, they have very minimal, certainly compared to Kentucky. So this has been a constituent-driven issue. When I've knocked thousands of doors, this has been a top 3 issue, not only when I ran the first time, but again this time. Things certainly are not better. As you know, Boone County, we are a rapidly growing county. I think we're the 4th largest now by population in the Commonwealth. And yet we have one monopolistic healthcare system that has effectively kept out anybody else who's wanted to come in. So the people are crying out for choices in healthcare providers where they don't have to have prolonged waits to get in, or maybe they want a second opinion, and it's forcing them to go across the river. So we're taking our healthcare dollars across the river, and for some people, their insurance may not cross state lines. It may be out of network, so it's a higher deductible, or Medicare and Medicaid don't cross state lines.
Got it.
So
it's definitely a very complex issue, and I know I've read a lot of the stories, and I've heard a lot of the testimony on that, so I do appreciate your work on that. If you want more information on Representative Proctor and the Certificate of Need issue, please visit her website below and also her contact information. Thank you.